Now we are going to start important immunohistochemical strains. The immunohistochemical screening is a laboratory technique that uses antibodies to detect and revealize specific antigens within tissue sections. Then it determines the primary site of origin for the metastatic tumors and characterize the tumors that are difficult to classify. And these have a strong strict unpredicted value. So first we are going to start with chromoglamine and synaptophycine. This is a strain that most commonly targets the neuroendocrine cells, and any cancer that is having neuroendocrine cells that will be detected by these genes. And we have most common examples: small cell carcinoma of lung and carcinoma tumor in neuroblastoma. The second is cytokeratin. The cytokeratin is epithelial-specific marker. Epithelial-specific screening any target epitheliases. So any cancer or malignant tumors that have got carcinoma that are related to epithelium will strain by cytokeratin, and it will detect epithelial tumor sarcoma and carcinoma etc. It's a Desmin. What does a Desmin? The Desmin is of muscle-specific type 3 intermediate filament proteins. The Desmin is muscle-specific type 3 intermediate filament protein that is present in muscle. So any muscle-regarding tumors that are like rhabdomyosarcoma, that will be detected by Desmin. Now there's one more thing, GFEP. What is GFEP? The GFEP is stand for gliaded fibrillary ethnic protein. I have it right here. Fibrillary acidic protein, and it will stain the neuroglia cells like astrocyte cells and oligodendrites, but it is a hallmark of astrocytes and that type of glands in the central nervous system. And the GFEP is a member of intermediate filament family and a pretty important really in maintaining the shape and function of astrocytes. So it's a basically main screening component of astrocytoma. Okay? Glioblastoma hanso. Neurofilament, of course, it will strain neurons, and any neuron-related cancer will strain by neurofilament and neuronal tumors. And the PSA, is you guys know, it's a prostate-specific intriguing antigen, so it will detect the prostatic epithelium, prostate cancer. Maybe having a PCAM 1 and CD34. If you guys know, it is helping transmigration of any cancer and any material they want to migrate. Okay, in these cancers, like in the endothelial cells and endothelial cells, mostly related with vascular tumors that enter sarcoma. At center to the neurocrine cells, a neuropressor that at center is present. So, we detect all the cancer cells, first you have to know what are the derivative neurocrine cells, like melanoma, schwann cells, like glands, like bone. The neurocrine cells, derivative cancers related by ascendant like melanoma, schwannoma, ligand cells, histiocytosis. We have in the component TRDP. TRDP stands for that resistant acid phosphatase. It is a basic iron binding protein. It's a basic iron binding protein found within the cytoplasmic granules of the cells of hairy cell leukemia. So, it will detect the hairy cell leukemia. It is a type of B-cell leukemia. Or if you want to differentiate hairy cell leukemia with other B-cell leukemia, so we have to differentiate by TRAP. This one more, Vimentin. Vimentin is a protein that belongs to intermediate filament family and a primary found in mesenchymal cells. So the Vimentin, it's a bond to mesenchymal cells, so they will target the mesenchymal tissues like fibroblasts, luteal cells, macrophages. So any cancer related to mesenchymal like sarcomas will detect it by Vimentin. Don't forget that all immunohistochemical team that on main basic key points and then MCQs. when you see these things, you will automatically get your answers, okay? That all immunohistochemicals on just the staining properties of the cancer in the laboratory technique that uses antibody to detect the uvular specific antigen within the tissues. Sections.